Well, this morning we welcome our friends from Titusville Area Hospital, and Kelly Clark joins us. She is the Marketing and Communications Specialist with Titusville Area Hospital. Also brought in Dr. Rubin. We say good morning to Dr. Rubin as well. What a rough week for her. Not only did she find out she's going to be on this show, but her Baltimore Ravens lost, and it's just been probably a rough couple days. So we'll get to Dr. Rubin here in a moment. Kelly, welcome.
Hello.
Happy New Year to you.
Thank you. You too.
All right. There's a lot going on.
A lot going on, as usual.
Yeah, that's great. And it's going to be another busy year for the hospital.
Definitely a busy year. We have a lot of new things happening. So, yes, we look
some
forward
good
to
news to start the year?
Some very good news.
Yeah.
Some very good news. It was just released yesterday. The American Hospital Association named their leadership award winner and finalists. So what this award is it recognizes small and rural hospitals that display outstanding leadership and responsiveness to their community's health needs. The American Hospital Association is an organization that's nonprofit. It's made up of different healthcare providers and individuals that have a common interest in improving healthcare within their communities.
That's really cool.
So we were named a finalist in this national award. So we were very proud.
When will you find out?
So it has already been announced we were not the winner.
Oh, okay.
So the Southwestern Vermont Medical Center in Vermont was announced the winner. However, they did recognize us as the finalists. So.
Nice.
Yes.
That's awesome. Very good. And it seems like every year you're nominated or you're in the top 10 or top 5.
Yes.
That says a lot, doesn't it?
Yes. And so what a lot of these awards look at is improving healthcare within the rural setting. Bigger hospitals, they do research, they do all of these things, and they are usually nationally recognized. But it's really great to be a rural hospital and to be recognized for these things because we focus on things that, affect our community directly. Adding clinics, like we just added our clinic in Tynesta and Titusville. Those addressed some transportation issues of patients that weren't able to get primary health care on a regular basis. So those are the things that this looks at.
And you think, what's 10, 15 miles or 20 miles? But it's a lot, isn't it?
It is.
Yeah.
It is. I mean, if you look at the weather today, people that are living in remote areas, it's hard to get your kids even on the bus.
Yeah.
As I just did this morning.
I spoke to some friends over probably the last month who live near some bigger hospitals, and they said to me, how did Meadville and Titusville get vaccines and we're still waiting? I mean, what's that say?
Yes. Yeah.
You guys did your homework. You guys were prepared and ready to go.
Yes. We've had a COVID team that has been working on this, and months before even getting the vaccination, they were ready for when it rolled out and when we received the vaccination. Wow. We didn't start planning after we received it. The planning was months ahead of time.
And there's been stories where hospitals have had supplies and they haven't been able to get them out to folks. And it's been crazy. Yeah,
so between Meadville Medical Center and Titusville, we have administered over 7,000 vaccinations.
Over 7,000?
Yes.
Wow.
Holy cow.
So that is collectively, but we've only managed to vaccinate 5% of Crawford County, which doesn't sound like a lot, but if you look at it per capita, I mean, we're in the top 10 of counties that have been able to get this vaccination out to people.
That's wonderful.
Yeah.
Good job. Congratulations on that. Speaking of vaccines, if folks are trying to get as much information as they can, what can they do?
Yeah, so we're definitely overwhelmed. As much as we are getting it out there, like I said, it's only 5% of the whole county. So we are reaching out to folks we have to follow the mandated schedule that's given to us and has changed several times since it's been given to us by the Department of Health. So we do have to follow that schedule of the list of who gets the vaccination next. There's a lot of behind the scenes work, getting the vaccination takes a lot of paperwork, and also scheduling the patients, calling the patients, calling these different fire departments, getting them here, and then there's paperwork that has to be done afterwards. We have to turn that in of who we gave the vaccination to. So a lot of work. So
you said you haven't slept in 18 days,
yeah, I think so.
weeks, something like that? Yeah. So,
so.
Is there information on the website people can?
There is. Okay. There is. So we've been getting a lot of phone calls to our clinics, to our hospital. Takes a lot of time to answer all of those calls. If folks do have the ability to get on the computer, we do recommend you go to our website. If you go to our homepage at the very top, it says information about the coronavirus. If you click on that, it takes you to more information about the vaccine. So, yep, right there. So if you if you click on that, it takes you to an actual form that you can fill out. So if you are interested in getting the vaccine, you put in all of your information, you are added to a list. The list is being compiled by Meadville Medical and Titusville. So whether you want a vaccination at Meadville or whether you want one at Titusville, it's the same exact form. It goes to the same exact place, and it's filtered that way. It is taking us a while to work through this list because there are so many people on it, but we do want you to know that you are being heard. If you don't have a computer, we recommend that you talk to a family member, and they can help you get your name on that list. You can also contact your PCP and see what they recommend. We hope that other hospital organizations in the area are going to start to release their vaccinations and start to get them to the public. So we definitely want you to call your PCP.
Okay. January. What's going on in January?
Yeah, so January is National Cervical Cancer Awareness Month, which is why I brought Dr. Rubin on with me. She's our new gynecologist at Titusville Hospital. We're very happy to have her. So we've been getting a lot of great feedback since we brought her aboard.
Dr. Rubin, good morning.
Good morning.
Thanks for being here again. How's everything going with the practice?
Everything's going great. We have a new space that we're in, a brand new space, so that's been great. And I've been seeing a wide range of age range from 15 up to 80. So, that's been great too.
We talked about that before, how important it is to, at a young age and through life, not just, hit a certain age and say, well, I've done my time, I'm done, but to continually come in and to just make sure everything's, on track.
Yes. I mean, women should be coming to their gynecologist every year. And even though the American College of OBGYNs has changed how frequently we do pap smears, which is not every year anymore, we still recommend that women come in yearly. And this is Cervical Cancer Month, so we are focused.
For now, we're going to work on changing that, though, I think.
Yes. So we're focusing right now on the pap smear. Cervical cancer, for those people who might not know what the cervix actually is or where it is, it's the part of the womb that connects to the vagina, and it's the opening of the womb. And cells there can become abnormal and turn into cancer. It used to be the fourth leading cause of cancer death in women in the United States, but after the pap smear was developed, that's been going down every year. And now we have a vaccine, which is awesome. But worldwide, it's still one of the leading cancer deaths, causes of cancer death in women. It also is one of the cancers that we know that is caused by a virus. We know what the cause is. It's a sexually transmitted virus, which is called the human papilloma virus. That virus is actually the most common sexually transmitted disease in the world and in the United States. And which is why we now have the vaccine to try to vaccinate young people so that their risk of cervical cancer will even be less, and perhaps we could even eradicate it if we could get all of our young folks vaccinated.
That's a big swing, isn't it, from the number infected to possibly having
Absolutely.
Few, yeah.
For the age group before the vaccine was available, there were studies that showed that when they looked at women coming in for birth control and they just tested them to see if they were positive for HPV, anywhere from 50 to 80% of the women in that clinic would be positive for HPV.
Wow.
So it's a really common infection. Very small numbers of women will get cervical cancer from this infection, but it is something that we can try to prevent at this point. HPV comes in a lot of varieties. There's like 100 different subtypes. For the genital area, there's 40 subtypes that are most common, but we really narrowed it down to two types of the virus that are the most common with cancer, with cervical cancer, and about 7 that cause the majority. And if you get vaccinated, the risk of cervical cancer drops by 70 to 80%. And then we also vaccinate for the 2 types that cause genital warts, and we can reduce that by 90%. And most of the time the vaccines are given by the pediatricians. It can start as early as 9, but the average is usually around 11 to 12. And most insurances will pay for it up until the age of 27. But in fact, it's been shown to be safe even up to the age, and effective even up to 45. So that's great news. We also have we've learned a lot about how this virus works and how long it takes to develop cervical cancer, which is usually around 10 to 20 years. The most common age group for cervical cancer is between 30 and 40, though the average age group actually happens to be 50. So that's the time period where you really need to be vigilant. We start pap smears at the age of 21, and if you're normal, you can go as far as 3 years. I personally like women to have it a little more frequently, like 2 years, but the American College of OBGYNs does recommend 3 years if you're normal. And then starting at the age of 30, we can either just continue with the every 3 years, or we can test for the HPV virus, which is really probably the best way to do the pap smear. And then if those are both fine, you could technically go to 5 years. Though again, I prefer that every 2 years.
A lot can happen.
Exactly. And not
time.
only that, but we want everybody coming to see us for other female issues and not just the pap smear. Pap smear turned out to be a great way to get women in. They thought that they needed it every year, so they would come in every year, and then we could take care of all of their needs. So even though we may space out the pap smears, we still really want patients to come in every year.
What are symptoms? So if somebody's saying, boy, something's going on, something's not right, what are symptoms?
Well, it's interesting because mostly there are no symptoms.
Okay.
So, and that's one of the reasons why we came up with the pap smear, because by the time there's symptoms, you actually have cervical cancer.
Oh, wow.
So we want to try to catch it before women get cervical cancer. We want to catch it in the precancerous stage. And the precancerous stage is usually asymptomatic. The first sign of either a severe precancer or into the cancers might be irregular bleeding or bleeding with intercourse. Bleeding with intercourse is probably the most common. And then some women will get a discharge, but to be honest with you, I've actually never seen that. So most of the time it's bleeding that brings patients in. And most of the time with cervical cancer, it's a woman who hasn't had a pap smear in like 10 years. And then she all of a sudden starts to either have irregular bleeding or bleeding with intercourse, comes in, we do the pap smear, and that's how we figure it out. But if you come in for your regular pap smears, we shouldn't get to that point.
Yeah. Do you find that are women more open to scheduling that appointment and coming in when there's a problem, or do they say, well, let's see if it goes away?
No, I mean, I think that most women are pretty in tune with their body, and when all of a sudden it starts doing something they're not used to seeing, it's usually a red flag to come on in.
Okay.
But I would love to see, women making those annual appointments and also just making that relationship so that if in fact something does change or goes wrong, they have a relationship with me and with the hospital.
Great information as always, Dr. Rubin. And Kelly, folks can schedule appointments and get in and see Dr. Rubin?
Absolutely, yes.
Like right now?
Right now.
Right now.
She's always accepting new patients, and like I said, we're really happy to have her as an added service within our rural health clinic at the hospital. She's located right on the first floor. You can call her office at 827-9770.
All right. Dr. Rubin, Kelly, good to see you this morning.
Good to see you.
Lots of great information. And again, people can go to the website to learn more.
Yes, you can go to the website to learn more. We'll definitely be probably releasing some things on Facebook if you follow us on social media. But yes, I would say, be patient. We are trying as hard as we can. We're light years ahead of other organizations that are putting the vaccine out. So I think people are seeing how far ahead we are, and it's really great that we are. I mean, we want to get that out as fast as possible, but it is going to take some time. So. And
if you haven't been checked out in a little while, Dr. Rubin, they can call you and schedule that appointment.
Absolutely.
All right. Great to see you guys. Thanks so much for coming in this morning.
Thank
Take
you.
care.